So good evening, everyone. Glad it's nice and warm in here, maybe a little chilly for some, but just want to, thank the Alzheimer's and McCormick Home for inviting me to share a topic which is kind of dear to all of our hearts, but it certainly is something that's so important to all of our hearts as well. So I'm coming from the perspective of Memory Clinic. I guess I go here. When I talk to you about dementia and driving. And hopefully this will give you a little bit of an idea from a healthcare provider's perspective of what it's like when we're trying to make that terribly awful decision of whether there needs to be some changes with our people that are in front of us when they're driving. So at the Memory Clinic, just to put it into perspective, what we do, we see people, we identify people with early, ideally, memory issues and cognitive or thinking problems, educate them about some lifestyle and medical changes that could be made and options, recommend them some community resources like the Alzheimer's Society and this group here as well. And ultimately, the goal of our Memory Clinic is to take the burden away from the geriatric services that are pretty limited for our vast aging population that is going to get more and more, so that we can get services done more appropriately with people as they age and enter these challenging times for some. And then last but not least, we assess the risk in driving, in safety in driving as we assess each of these people, which really is, and I think we can all say, whoever is in part of a memory clinic, it's one of the most challenging, difficult, and emotionally, if we have a challenging, or what we'll say a bad day at the end of the day, is because we've had to address driving with some of our people that have been in front of us. So at our memory clinic, we have a comprehensive 2 or 3 hour assessment of our patient's memory. We go into thinking abilities, their mood, the safety in driving, and overall functioning. And we do this by an interview with the patient and some paper testing that is being done with them. And then at the same time, separately, there is an interview with a family member or close friend, just someone who can really tell us what the person's functioning in every part of their day-to-day activity as such. Some of the questions that we try to go over with the family members helps us to guide us to actually get a sense, is there some concern with the safety in the identified patient's driving? And I think all of us, if we can kind of think of, if they were asked of us, of someone that was close to us, we would realize that it's as objective sort of as we can get from a subjective perspective as such. One of the questions is, do you or would you feel uncomfortable being a passenger when the person is driving? And, you've alluded to that, Phyllis. A lot of these you have already alluded to. But it really is interesting for us when we are talking to family members. Sometimes they'll say, well, I don't know. I've never driven with the patient. He gets home, presumably he's or she is fine. And it's interesting how there's been a kind of a optimism or maybe a naivety, or maybe they just kind of don't want to know. But we think about how comfortable you if you were told you had to drive with them. That's really is the more important. But interesting, even more so, if we ask that pointed question, if they have a grandchild, for example, would you want your grandchild to be going driving with this person? Would you feel comfortable with that? And it is fascinating to me how fast that no comes out many times, because that is just kind of the heart comes out, because they just would want to protect that. And then another part of that would be if your grandchild was crossing the street in front of this person who is driving, how comfortable would you be as well? So very telling. I almost feel that that's kind of one of the more important questions that we use. Other ones are, has the person had any accidents, near misses, fender benders, scratches on the car, which have just kind of arrived as such without any explanation, or traffic violations. And I often will say, has anybody been, more honking or the horn and kind of saying, like, how come you haven't put your signal light on or something? You know how our traffic is, particularly in London, we'll say that they don't let us away with a whole lot. So, but has that been occurring as well? Have you noticed the person self-restricting their driving habits? And, Phyllis, you alluded to that as well. And I have to confess, I self-restrict to the 401. I don't like driving there as well. So I'd have to answer that, and my family would as well. But looking at nighttime driving, there's wisdom in that, 100% wisdom. But at the same token, that tells us some information as well. That if they know they don't have confidence in going here or there at certain times, the busy streets and all the rest, that if they don't feel they have judgment is good at that point, then chances are if suddenly just a block away from their home, a little child ran out following a ball, they too may not be able to make the judgment and react quick enough to actually avoid hurting that child as well. I remember I spoke to a police officer many years ago. There was about accidents or something, and he was saying how many accidents happen within a block of people's homes. So the fact people say, I just do my familiar streets, just doesn't kind of cut it as such from there. Although the familiarity is fine, but things can happen so quickly. Have there been occasions where the person's gotten lost or shown navigational confusion? And that's interesting, because we will often ask, these questions are sort of alluded to with the patient as well, but often they're not going to share that, or they don't recall that as well. They just, feel that they were just in a different spot and they eventually got their way home. But it also is very fascinating, some of the stories we do hear. Just this week, I did have a patient in who told his family he was just going next door to Loblaws, which I guess was a block or two away, and didn't return, and then about an hour and a half later, the wife got a call from someone who had found him on the way to Hamilton in the ditch. And in recall, he can't explain where he thought he was going, or the fact that he got from North London to Hamilton in one piece, and he physically did okay. It was just the car was pretty banged up. It was pretty impressive, and thank goodness that no one was hurt along the way. But it's just, we want to avoid this, is what we're kind of coming from. Have you or others seen unsafe or abnormal driving behavior? And often neighbors and friends will put some little kind of ideas into people's heads as well, saying, so pick up if you're a family member, if someone is saying and trying to be so kind, and saying, how much longer do you think Charlie's going to keep driving? Or something like that. If the topic is brought up, perhaps ask them why and see if they have seen some driving behavior that they've considered unsafe as well. So it's all information. And, we feel so bad because it feels like we're kind of picking on this person, but not at all. We just want them to be very, very safe and not harm any other. I always say I don't want the people to end their driving career with some terrible thing that they're going to feel so guilty for the rest of their life as such, or be harmed themselves. Are there any cues, directions needed from a co-pilot? And many times we hear this, and couples are just so wonderful. They've lived together for 50, 60, 70 years, and they can almost interpret everything as they go through life. And they will just say, well, no, he drives very well. I just have to tell him where he has to go and when to turn and put his blinker on. But he's the best driver, never had any problems, never had any accidents. So we know they're good as a pair, but not so much maybe one-on-one. So these questions do really kind of bring to light any concerns we have as well. So again, back to the memory clinic, after we've got this information both from the patient and from the family member, then we as a team will meet and we will put all of the information together. We have been taught it's called a clinical reasoning model through the Dr. Linda Lee, who has, kind of orchestrated all of these memory clinics across Ontario. And then we can actually assess then where does the patient fall on the continuum of cognitive decline, if so. And then we will be looking at the specific testing on the paper, and specifically, along with all the other things we had talked about, look at driving safety as well. So the cognitive continuum, I think of so many things in health as like you got two ends to it. You got normal, healthy, the best ever, and then not so good on the far end. Then there's lots in between as we change. So the same with dementia and cognitive function as well. So we have normal aging, which is we all can know that things are changing as we get older, maybe slowing down, maybe things are just not going in and staying just as long, and they take a little while to come out again. I think maybe most of us can remember going into a room and saying, I'm here for something, but I just don't know what it is. And you have to almost go back to where you were to actually remember what it is. And then there can be times we can go and meet someone who you just know so well. But do you think you can think of their name right then and there to introduce them to, the person you're with? No. Walk down the street and bang, it's there, right? So fortunately, that's considered normal aging. And so we have to realize that we are all aging, though, and things are going to still continue to change. So we identify if the patient has abnormal aging. So that is really a great visit, because then we can reassure them and say, continue to be concerned, then come back, we'll check in another year or two or so. Then we have mild cognitive impairment, and Phyllis, you had alluded to that on the study as well, where they looked at that. So it is not officially been deemed to have dementia to meet the criteria for that, but there are some changes. So not really normal aging, but there have been changes. And mostly it's the functioning. They may have some paper changes, the testing may not be pristine, but they're still, from all the information we have gathered, the functioning is still intact. And then we have the good old dementia, and there's mild, moderate, severe, as you will see on those spectrums. And that is where not only do you have the testing has been not where it should be ideally, but there's also some functioning changes as well, and I'm going to describe that a little bit further down the road. So when we're talking about driving safety specifically for the person who has been deemed to have normal aging, we still address the driving. They've done the paper testing to look at the safety in that, and we just say, you know what, so far so good, continue on driving, we don't have any concerns, but think about when you need to retire from driving in the future. We have to retire from our jobs, we have to retire from this and that. So then we really need to kind of think about it, and we talk about how things change and to be really more self-aware, and then asking the family members as well to be aware. And I really kind of think of how nice it would be for me to decide when I want to stop driving, rather to then be told that I have to stop driving. There is a kind of a control and a kind of a freedom with that too. And so we kind of offer that. Think about it. Don't kind of just wait until you are being told, because I think that's when it's difficult. And so some people will actually report to the Ministry of Transportation themselves and get a little money back on their license as well, and their insurance, and say, I'm giving up my license and I won't be driving anymore. And then they don't drive anymore, and they're free, and they can feel really good. No, nobody told me I had to stop, but I chose to. There's a freedom in that. So the police, if something does happen, they have the authority to, send a report to the Ministry of Transportation, your physician, healthcare provider, your optometrist as well, and it's mandatory, which we'll talk about again. But it really, I really say, think about it so that you can make that decision is important. And I just threw this in because I find this quite fascinating, is that this is in 2012, so we've got a few years since then, and you know how the price of gas has gone. So I imagine the cost is higher, but it costs $13,654 per year to operate a mid-sized car based on 32,000 kilometers driven per year. To me, that's a lot of taxi rides, Uber rides that you could do, not having to worry about any of the safety issues as well. So if finances is kind of part of it, that might be something for you to think about as well. So if we determine this person does have mild cognitive impairment or mild dementia, so they just moved into a few early stages of some functioning, but it's quite mild, but the paper testing does show some abnormalities there. And if I should back up. If the paper testing shows that they're normal, and they haven't had any abnormalities on the paper testing, but there have been some changes in their functioning so they've been diagnosed as dementia, or if they have mild cognitive impairment, If their paper testing is normal, then we'll say, good, so far so good, but they will need to be tested again in 6 to 12 months because we know it can be very progressive, as you know, and so we want to catch it early before there's any issues. So depending on our gut feeling of how soon we need to repeat these testing, it may be 6 months, maybe 9 months, and maybe 3 months, depending as well. But they do need to be followed up very closely, even with those two diagnoses. I have some people with mild cognitive impairment who are quite stable. It's not everybody, about 25% don't move on to dementia. And I see them, I don't know how many years I've been seeing them. I see them kind of every 6 months for this, and then each time they come in very anxious, and they've been very steady, and there hasn't been any indication of having moved into a concerning state when we're doing the individual testing, but it really is anxiety provoking as such. So again, every time I see them is saying, what, 5 minutes left? Oh, okay, sorry. And I will move on. I didn't know I was being timed. So anyway, you got the idea. So if they're abnormal, so if we have the on-paper testing shows it's abnormal, we know that there's 7 times risk of having a vehicle collision. 7 times risk with that. So that shows that there are some people at the memory clinic, we won't even have them come drive home from the appointment. That's how worried we are as well. These findings need to be reported to the Ministry of Transportation, and they need to be, when we tell them they need to retire from driving then and there, they may need to repeat the testing. Let's say they had the worst migraine in the world the day they came in for the testing. That's not fair. We'll just repeat the testing. Or they should be referred on to the drive-able testing, which we'll talk about. And they can challenge this, if any of our decisions, by doing the drive-able as well. And this drive-able test is what Parkwood has, and many people are likely aware of, that what we use is our Fitness to Drive program. And it does cost, unfortunately, that's the negative part. It's a personal cost, $550, but it is tax deductible. They'll send a report to the ministry, and they will inform the person right at the time after they've done the testing paper, as well as on road with an occupational therapist, whether they are considered safe to drive and what their report will be. If they do pass, they will need to be followed up in 6 to 12 months, likely with drive-able again, paying it again as well. So if they have moderate to severe dementia, people who are diagnosed with it are considered to be unsafe by the ministry. So we do the report to them, and there's very little chance that they will likely disagree with what we have, information we've given, and they likely will be telling you that you should not be driving and be suspended from driving. So moderate dementia is the inability to perform 2 or more instrumental activities of daily living. So you can see them out there. There's medication management, handling money, bills, banking, shopping, telephone and tool use, preparing food, social functioning, and household and hobbies. So these are the things that take a little bit more processing to do. So if you're not able to do 2 of those, then they would be considered to have moderate dementia, or one of the basic ones. So basically looking at themselves as far as hygiene, bathing, toileting, dressing, feeding self as such, then they would be deemed to be not safe to be driving and have moderate dementia. And then severe would be onward. So officially, we say persons with frontal temporal dementia, Lewy body dementia, Parkinson's disease dementia are generally considered unsafe to drive by the Ministry of Transportation as well. And we do feel bad about that, but it is true. So just to point again, it is mandatory for healthcare professionals, physicians at this point, optometrists, and soon for nurse practitioners like myself as well, to report any concerns with anybody for any medical reason to the Ministry of Transportation. I liken it to child abuse. If somebody comes in and you think a little child is being abused, there's just it supersedes anything. We must report that. This is a legal obligation. And so it's something that you cannot be angry at your physician because they're doing what they legally have to. They have to retain for the safety of the society. And they're advised to err on the side of caution as well. We just give the data, and then the ministry looks at that. The other thing I just wanted to point out, there's many medical conditions too that fall the same way. Dementia is just one of them, okay? And often we will have to look at the whole picture together. If someone is on oxygen and has COPD and getting chest pain and they have dementia or mild cognitive impairment, it's like, I don't know which is the worst, but you shouldn't drive. Nobody wants to be driving on the road and having someone having a stroke potentially coming towards you as well. So this is your dementia and Alzheimer's. You can see how it's just one of the many ones. Alcohol, seizures, there's many, many that we are supposed to report. So what happens after a report is made to the Ministry of Transportation, based on the information submitted, a medical team of the ministry will review it, and then they will determine whether they're safe or not, and they will then contact the person by mail with the outcome and the recommendations as such. And that's not Sasha, but I thought that was pretty cute.